while the U.S. Department of Justice and the Monitor have pushed the Department of Correction, we have also used them. They're the boogeyman. I mean, talk about an inappropriate way of putting it, but they're the boogeyman in the background that have held us all pushing forward, and the ever-present threat of litigation against the state of Delaware and then a potential takeover of healthcare, as has happened in other states, has given us momentum both within the department but also within the state government. It's given me the support that we've needed within the legislature to get some of the things accomplished that we wanted to accomplish anyway. I don't think the state needs the federal government anymore. In years past, the Department of Correction could wash its hands of medical issues by saying it was the provider's responsibility, not ours. And that day is past, but also the mentality within the Department of Correction has adopted the new philosophy that it is our problem to solve as well. Well, you have to be vigilant, and you have to have independent-minded people involved in the process who aren't afraid to stand up and be heard when they see something that's not appropriate, that's not right. And you need some accountability from outside of the Department of Correction, and in my own personal opinion, outside the state, outside of the state government system. And that's why I pushed hard and created the Adult Health Care Review Board. That's the panel that will oversee what we do. And I think that's going to be the linchpin. We've already received interest from over a dozen vendors who are interested in a piece of the contract, including 2 local physicians groups. So it's very possible we could end up with a local contractor providing services to the MA population, and obviously they've got more of a vested interest in the state. They've got more of a vested interest in their own reputation in the state. Unfortunately, changing vendors, going through this whole contracting process is not going to lend itself to stability. People on the ground here in Delaware don't know whether or not they're going to retain their jobs, and so there's going to be a disruption here for a period of time. And then with the new vendor, new contract, the stability that comes with a new contract, I would expect that the progress that we have made will be resumed.